now for our mental health moment. Stronger Together, Lewiston-based Common Ties Mental Health Services has merged into Sweetser, creating Maine's largest provider of certified community behavioral health clinic services. We are joined today by Sweetser's President and CEO, Jayne Van Bramer, to discuss how the merger impacts access to treatment, among other things. Jayne, thank you so much for being here.
Thank you.
This is exciting news for you all, so can you explain how the motivation behind the merger and also what it means for the community?
Sure. Well, Common Ties has been serving the Lewiston community for over 40 years, providing really essential mental health support to 300 individuals at any given time. But workforce challenges, operational complexities, funding uncertainties really make it difficult for smaller organizations to remain independent. And Sweetser was not going to let Common Ties go under. I mean, for nearly 200 years, Sweetser has really adapted to meet the evolving behavioral health needs of Maine communities. And this is just an example of that legacy of leadership. Just like when we opened our Hope and Healing Center in response to Lewiston needs. This is really, with this consolidation, we become the largest certified community behavioral health clinic in the state of Maine, and we are the only provider to fully implement walk-in care access.
Incredible. Sometimes you hear merger and you think what will happen with staff, right? So I guess one of the big questions is, what does this mean for the existing staff of Common Ties?
Sure. So we have been able to offer employment to their entire team, and the vast majority has already joined Sweetser. And what this means for clients is they're going to be able to maintain their same trusted case manager. But they also have an advantage now, because now they have access to a full range of behavioral health services that is really only available with a larger organization. So whether it's medication management or therapy or peer support or employment support, they can get all that now at our Hope and Healing Center.
Wow. And so on a bigger scale, what does this say about the state of the behavioral health system in Maine?
Well, as you probably know, it's difficult to be a behavioral health provider right now, especially a smaller one. Workforce challenges, we're all competing for the same limited pool. There are, delays with payment, and there's a lot of uncertainty about some of the policies coming out of Washington. So I think, this underscores the fact that it might be time for some smaller organizations to think about joining a larger organization, because there really are advantages when you're part of an entity that has more staff, more resources, more programs.
And if people want more information, if people are seeking treatment and perhaps, don't really understand the merger, if they have any questions, where should they go?
Well, they can certainly walk into our Hope and Healing Center Monday through Friday at 20 Mollison Way. It's right next to Just-in-Time Recreation, or they can get more information at lewistonhealing.org.
And that's one of the great things about the Hope and Healing Center, right? You can just walk in.
Absolutely.
And that's what we've been talking about as well. All right, Jayne Van Bramer, thank you so much for joining us.
Thank you for having me.
We appreciate that big news here. Thank you so much.